When you face something life-threatening like cancer, you're even more appreciative and blessed with time. So I really do not take a single day for granted. My name is Dr. James Duke. I am a currently retired orthopedic surgeon. I was diagnosed with a squamous cell cancer of the tongue. That's all you hear is that, hey, you've got cancer. I don't think you listen to anything else that the guy's saying to you. Oh, man. I had to tell my family, and I had to get that support system set up, and they rallied around me like champions. I soon found out that there was a super talented doctor. He kind of laid out the plan. I got some scans done, found out I had a lymph node that was involved, and so he outlined the possibilities for treatment. I really believe that the key when anybody gets a diagnosis is gather as much information as you can. Whether it's on the internet, whether it's through friends, colleagues, coworkers, find people that have been through it. So I went to both my ENT doctor and my oncologist with two requests. I've heard a lot about immunotherapy and something that I think has a chance to help me boost my prognosis. And so I want to do that before surgery rather than afterwards as a recurrence treatment. And then B, I want to use this blood test called Signatera, measuring any MRD, molecular residual disease, that's floating through your system. The key to it is they have to get a sample of your tumor, because then they analyze that DNA and then they make a tailored test to each patient. It's personally helped me significantly because I had a positive level before I did my immunotherapy and surgery. And then after my surgery and immunotherapy, my level has been 0 for the last year and a half. I would say that it's been remarkable for me and something that's prevented me from having to have any adjuvant therapy, meaning radiation, chemotherapy, and those kind of things, because I've had a 0 level. I've been comfortable saying that what I've had so far has been enough to treat my cancer. My practitioners, even who had not used Signatera before, have both said the same thing, that they're comfortable with me having a 0 level. I firmly believe that something as sensitive as the Signatera test will pick up far in advance. It could be that on a scan it would be a 1 or 2 millimeter lesion that'd be hard to see in a bunch of scar tissue. But because the blood tests will be positive if the tumor recurs, then you're going to know sooner, and in cancer, sooner is better. I've been super impressed, especially with my ENT physician, who went from using it in 0 patients, who now uses it in every one of his patients. I'm so thankful that tests like Signatera exists. I just think that Signatera fits nicely into that framework of how physicians and experts are approaching cancer. I've been a high achiever my whole life, never wanted to have a 0 in anything, but every time I get a Signatera test, I want to see a 0.